Hey guys, Dr. Stephanie here, and today we're going to go through some exercises that help with hip pain. So hip pain can be in the front of your hip, kind of in this area by your groin. It can be on the side of the hip. A lot of people refer to that as bursitis, but it's since been called greater trochanteric pain syndrome, or it could be a tendinopathy. It's not necessarily a true bursitis if you have pain in the side of your hip. Hip pain can also be in the back, kind of in the glutes area or the deep in your butt. So the hip is a ball and socket joint and it moves all different directions. So it's very common to have pain in that area, but we can do some things to strengthen the muscles around the hip, also increase some mobility to decrease any pain you have, and also prevent any pain or injuries in the future. So we're going to go through these exercises, and these are all exercises that strengthen different muscles around the hip to really support that hip joint and decrease any pain that you're having there. So for the first one, it's called sideline hip abduction. So abduction means away from the body. So we're going to lie on our side, make sure our body is in a straight line. You almost want your legs to be back a little bit. You don't want them up here. You want them kind of back in line with your body, and you want to bend this bottom knee here. Now with the top leg, you want to pull your toes back towards you. Make sure they're pointed straight out, and you're just going to lift this leg up as high as you can, and it's not going to go super high. So a lot of people think they need to go up as high as they can, but if it goes higher, your knee's going to bend, your foot's going to rotate up, and then we're not using the right muscles. So we want to keep our foot pointed straight, keep our toes flexed back towards us, and then just lift to about here and then back down slowly. So you just want to lift up and back down. And make sure you go slow, because if you go fast, you tend to not do the exercise correctly, and then we're not using the right muscles, and you just may not feel anything. So you want to do 2 to 3 sets of 10 here, just up and down, nice and slow. Make sure you take a break after the 10, just allow everything to kind of reset, relax, and then you lift and do 10 more of those. Okay, so for the next exercise, I'm going to show you with the opposite leg. So this is called hip adduction, and the adductors are those muscles on your inner thighs. And I feel like those muscles are missed a lot when people are just working out, or even if they're trying to rehab an injury, but those muscles support the hip as well. And a lot of times they are weak because we're not using them as much as we should. So for this one, you're gonna lie on your side, cross this top knee over the top onto the floor, and then you're gonna lift the bottom leg like this. Again, you want your toes pointed straight out, and you just wanna lift. This one you can lift as high as you can comfortably, and then back down. Again, you wanna go nice and slow, just like that, up and slowly down, up and slowly down. And again, you want to do 2 to 3 sets of 10. You want to do this on both sides as well. If you're only having hip pain on one side, you can do everything on the one side. But if you're wanting to prevent pain, or even if you're just having pain on one side, it's kind of good to do them on both sides, because then you can prevent hip pain in the future. Okay, for the third exercise, we're gonna grab a ball, just like this, a small little ball. If you don't have a ball, you can use a pillow or a rolled up towel. Place it between your knees here and lie on your back with your knees bent. What you wanna do is squeeze the ball, so we're using our adductor muscles again, and then lifting our hips up off the ground, and then coming back down slow. So we're using our glutes and we're using our adductors here. We're also working our core muscles. It's important to have a strong core because that takes stress off of the hips as well. So we're just lifting and coming back down. Again, slowly. Lift up as high as you can comfortably, and then come back down. You want to do 2 to 3 sets of 10. Nice and slow. Just like that. Okay, so then we have 2 more exercises, and these are going to be on the side. So you're gonna lie on your side, but you're gonna be propped up on your elbow here. And what you wanna do is, we're gonna do 2 different exercises. We're gonna place this ball between our knees, or a pillow if you have it. And so we're using our adductors again. We're also using our hips and our core muscles. And so what you wanna do is you just wanna lift up into a side plank. So your body's kind of in line here. Keep your knees bent, and then come back down. So this is called a side plank lift or a modified side plank lift because our knees are bent. But this is a great one for improving hip and core and adductor strength. So you want to do 2 to 3 sets of 10, and then you can go ahead and flip and do the other side. But just like that, lifting up as high as you can, just pause for a second or two and come back down, lift, and back down, and lift. Okay, so for the next one, we've got to make it a little more challenging. We're gonna do the same movement, so we're gonna come up here, but instead of going back down, we're gonna lift our top foot and bring it back down. So this is called hip internal rotation. So our hips need to rotate, not just flex and extend. So this is working on some hip internal rotation, both strength and mobility. And then we also have to stabilize with our other hip. So it's working on the other hip as well. So you want to do 2 to 3 sets of 10. I would do this one on both sides because this exercise really works both hips at the same time. So all 5 of those exercises will help build some hip strength, some hip stability. They're kind of a great starting point, and then you can progress to sitting exercises, standing exercises, more challenging balance exercises to really improve that hip strength and stability. So try adding those to your routine. Hopefully that helps with a little bit of your hip pain.